According to a news that I'm reading online, Jamaica News, Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, says he's satisfied with the progress of work to rehabilitate the main building of the Cornwall Regional Hospital, CRH, in Montego Bay, St. James. If it's the first time on my channel, don't forget to subscribe, like, comment, and share. The work include renovation of the roof, which was done at a cost of approximately $1 million, and the installation of a new ventilation system, which has been completed, as well as gutting on and the removal of derbies from several floors now underway. Dr. Tufton, who visited the Type A facility on Friday, January the 10th, told journalists that we are also doing the work on the ground for the new children's hospital. So it is very active. It's a very active site, as you can see, and I'm convinced that when this is all over, it's going to be a model facility for all Jamaicans and indeed for the Caribbean and beyond. He said he had it. The minister also met with consultants, unit heads, and staff of the hospital to get an update on the extent of healthcare service delivery being provided amidst the project execution, as well as related challenge being experienced and concerns arising. Based on their feedback and his observation, Dr. Tufton lauded the staff for displaying the level of professionalism resulting in a high-quality client service delivery being maintained. He urged residents of Western Jamaica who use the institution to continue to exercise patience and to utilize the alternative arrangement that has been made to deliver service. Dr. Tufton said the institution is always open to provide the best health care possible and assured that this is going to be much better facility when it is over, as there will be more beds, more specialization, and more technical services. While acknowledging that it is going to take a while for the project to be completed, he nevertheless said we are making progress and encouraged the public to give us some time in this regard. My viewers and subscribers, Montego Bay Cornwall Regional Hospital is one of those hospitals my family in the St. James area has to use, because we are not rich to have money to go to every time to the private doctors. And even when you go to the private doctors, so as when you go to the Cornwall Regional Hospital, when I look at it, it costs almost the same. I have a patient, I would say a patient who has cancer and is still waiting on a bed, but there are no beds because the facility, as we have understood, is still not in its proper function. Dr. Tufton, when you said that you are satisfied with the progress of the Cornwall Regional Hospital and the rehabilitation, I wonder if you're talking to really the people that has to really use this facility, because I'm sure that even the doctors and nurses are working there. They can say that the situation that they are working on is inhumane. And I can say for some patients that I have heard gone there themselves and have still been complaining. How can you be satisfied with a unfinished building? And you said this cost $1 million. Is it Jamaican dollar or US dollar? Because I'm still not getting it, and I know that a lot of Jamaicans are also not getting this too, especially those in the in the western region of Jamaica. Talk to the people and let them understand the fact, truth, how this thing is going. Because somebody is lying. And Dr. Tufton, I know that you're a doctor, but I don't want to tell you that you're a liar. But the fact, truth of this matter is this: somebody is lying to the people, and because people are complaining. People are typically complaining, and you are saying that you're satisfied. Satisfied with what? Since this leakage has started in the hospital, there was room for improvement before the leakage was going on, and this foul smell and all that kind of thing. And people have been patient. So when you're asking people to be patient, I don't understand one of the reasons why you're telling now people to be patient when they have always been patient before. Honorable Tufton, Dr. Tufton, Christopher Tufton, or how you want to emphasize your name. Tell the people the truth. Come out and tell the public the truth. We know that the Cornwall Regional Hospital is under extreme rehabilitation. A complete new structure or whatever, some part needs to be met. But don't lie to the people. Don't lie to the public. Not even the journalists you are talking to. I'm sure some of them would really want to know the full fact of what you mean when you emphasize on the word that you are satisfied. Satisfied with what? With the money that was given to a contractor, burned down to another contractor, come and divide it up, and the place is not yet been done. There's no facility that is already finished. That they are over in the lawn, where you call it over there, in that place the people sit outside in the sun for hours. So you come with a number early, and even when night you not get finished. So I want to know, Mr. Tufton, who is satisfied? You, because it's not the public that is satisfied. They are not satisfied with what you are thinking of your satisfaction. Because your satisfaction is not guaranteed anybody who sits out there in the morning, wake up so early to come in the morning, 5 o'clock, and by 9, 10 o'clock, their numbers are not yet called. And you say you're satisfied with the progress. Talk, real talk, and let people understand. Come down to the level where we can understand, because maybe your grammar is way above that nobody understand what you are talking about. So come down, drop past the Queen grammar, and get down to the Jamaican level of patois so that the people understand what you mean. My viewers and subscribers, I know that you yourself will also ask the same questions. I've got a lot of people who have been complaining. And to see this now, I have to ask Dr. Christopher Tufton this question. What is he satisfied with? The $1 million? And the people are still outside. Once again, my viewers and subscribers, this is JCon TV, saying the facts as how the facts are. My friend, walk in peace. Shalom.